I see a wide range of patients in my practice, and a lot of, in my mind, who I am treating are families. And so what that means is, oftentimes in a family there's someone who kind of takes the role of taking care of everyone else. And so I'm treating that person, and then that person is bringing the kids and the cousins and the parents and the whatever, and and so it becomes this whole thing where I'm treating them and they're also supporting each other in their process, and they're seeing results within each other and all that. So so my practice is pretty eclectic. A lot of people think about acupuncture as being largely used to treat pain, and that I think that comes from, number one, that acupuncture is really effective at treating pain, but number two, that Western medicine is not. And so people are looking for answers. They're looking for some other solution to their pain. And and loved ones want to support each other, and like, oh, my dad's knee really hurts him. Can I bring him in to see you? That kind of thing. So so people have in mind that acupuncture is for pain or treats pain, and that's absolutely accurate. And a lot of people think of acupuncture as specifically treating low back pain. It might be sort of top of mind for some people if there's low back pain, but it treats so much more than that. And when somebody comes in, often pain is the thing that will bring somebody in, but then as the pain goes away and they start feeling the benefits and understanding in a somatic way, the changes that are happening in their body, then they start to get this, oh, could this treat my menstrual cramps? Oh, could this treat my insomnia? Oh, could this treat my cousin's rash? Oh, could, and then, and it kind of, so because it does treat everything in the entire world. And, humans haven't changed much in the last, many thousands, hundreds of thousands of years. And so the problems that we had, thousands of years ago, we still have those exact same problems. And so this is a medicine that, that has been around for thousands of years and has been effectively treating people for thousands of years with the exact same problems that people have today. It's just, it looks a little different today. There might be a little different causes today. The stressors might be slightly different things, but people are still people and they still have the same problems. And so, so many people who practice Chinese medicine do end up, some people really specialize in fertility or pain or whatever, but a lot of people, have a very eclectic practice like mine is, because it treats so much. You can't, because people come to understand what they can get from it, and so then and it just falls into place. So yeah, so it's a pretty eclectic practice, but usually pain is the starting point for people.
That makes sense. It sounds like it's contagious. It's contagious for the people they share it with, but it's contagious for themselves, realizing all the things it can do for them.
Absolutely, yes, and I see it all the time, which is great. But and it's partly based on the concept that happy and healthy that's the default for humans. That's the way it should be. And as we start to treat things, people feel that and get that and move toward that and have a desire for that. And yes, and so then that kind of grows.
That makes sense. All right, let's jump into the big question. What is acupuncture?
Okay, so that's such a great question because it's such a bad question.
It's so broad.
No, not that it's broad, because there is, because of the misconceptions of acupuncture in the Western world, because people aren't familiar with it, and so the term acupuncture is part of is part of the misconception. So when we hear the word acupuncture, which is what we use, that's the term that we use to talk about, really what we're talking about is Chinese medicine. And Chinese medicine is an entire system of medicine that treats internal conditions and pain conditions and all sorts of things. And acupuncture is just one arm of that. But in the Western world, we use that term acupuncture to kind of refer to the whole thing, and so it's kind of confusing. So the answer to what acupuncture is one arm of Chinese medicine. And so, but what the question really is what is Chinese medicine, right? I think.
Sure.
And so Chinese medicine is a system of medicine that has been around for thousands of years. Our oldest existing text is, almost 3,000 years old. And that text, number one, is still used. That's like a textbook that you learn from, a 3,000-year-old textbook. And that wasn't like, hey, we're thinking about developing this thing. That was like fully formed 3,000 years ago. It's been, and had been used for, who knows how long before that. That's just the oldest text that we have. Mm-hmm. And so Chinese medicine is very different than Western medicine. It's very different than allopathic medicine, but it is a complete system of medicine that so the three arms of Chinese medicine are herbs, which usually are used to treat internal conditions, meaning conditions going on with the organs, but not exclusively. We use them for injuries, we use them for skin stuff and that kind of thing too. But there's herbs, there's acupuncture, which is really acumoxa therapy, which is utilizing the points. So a big concept in Chinese medicine that we don't have in Western medicine is that part of our anatomy is channels, and part of our physiology is energy. And so like these are concepts that are missing from Western medicine, which is part of why Western medicine falls short in certain things like treating pain, because they're not, and there's good reason for that in Western medicine, because as Western medicine developed from its roots in like ancient Greece and that kind of thing, Western medicine got to a point where there was this, science got to a point where there was this sort of battle between science and church about who was in charge of stuff, so things had to be separated in order for science to be able to dive into understanding the physical world. And so like the invisible stuff, the unseen stuff, the emotional stuff, psychological stuff, that became the realm of the church, whereas the physical stuff that we could measure and see and find evidence of, that became the realm of science. And so Western medicine grew out of that, where what they were working with was only what they could measure, see, find evidence for, etc. And so Chinese medicine is different from that in that there was never that separation. And so there are unseen aspects of the body, of our anatomy and of our physiology, that are incorporated into Chinese medicine, and qi being one of those. And so that's something, this concept of qi, which is usually it's usually translated as energy. It's not like the best translation, but that works pretty well. That's we have a concept of energy in Western medicine also, like having the energy to do something, and and activation energy for a metabolic reaction to happen, and we have this concept of energy, but it's a different thing. And energy, it's just a different thing. And so in Western medicine, we don't necessarily think about treating the flow of energy or whatever. So, but in Chinese medicine, we do have this concept of qi, or a life force energy that flows in channels throughout the body, and those channels have points along the way, and those points have specific functions. And so in acupuncture, what we're doing is we're finding where the person has obstructions to their natural state of being healthy and being happy and everything functioning well in the body. We find those obstructions through a range of different ways, and then utilize points that are going to kind of bring things back online for the person. So that so what we're doing with acupuncture is we're not fixing the person, we're reminding their body and their mind how to do it themselves. And so we're kind of, helping them to kind of remove obstructions that are in place to their natural healing. So we're supporting, healing, which is the natural thing that just happens. Bodies are made to do that. So that's what's happening. Yes.
I'm just wondering, would you explain the obstructions as physical or as emotional or energetic?
Yes, all of the above.
All of the above. Okay.
So and something that is physical is also existing on an energetic realm, and something that's energetic is also existing on a physical realm, and and so that means that we can treat them from either place, also from either direction. And and part of what's important for me as a practitioner is meeting the patient where they're at. So some people, will come in and be like, oh, I've had, I'm really stressed out, I'm having all these problems in my marriage and these sorts of issues, and like you can talk to them about what's going on emotionally for them, and from that figure out what's going on, what organs are not functioning well or whatever. And then on the flip side, there can be other people who come in and like, oh, my back pain, and and here's what it feels like, and this quality of pain, and this is when it happens or whatever, and you can use that information to figure out, so we have lots and lots of ways of gathering information. And in Chinese medicine, we don't distinguish between, we don't separate mental health and physical health from each other. It's all the same thing. And it's not even that it's a continuum, they're just different representations of the same thing. So, so if somebody has low back pain, there's a good chance that they have other issues going on around, either like around finances, around a feeling of support, like they don't feel supported, or they're feeling challenged by being the supporter of in the family, or lots of things like that, that where those things just coexist. So let me go back and finish. I had a thought that I strung way out. Were the three arms of Chinese medicine: herbs, acupuncture, and Tui Na. And so the Tui Na is the hands-on aspect of Chinese medicine. And so that's the part I think that most Americans are at least familiar with. But what that can look, it can look like massage, but it can look a lot like what we would call chiropractic. There's, so there's bone setting involved in that, and it can look a lot like physical therapy, but it also can look like, it can be like Tai Chi and Qigong. So those physical kind of things. So those are the three arms, and oftentimes, practitioners will then tend to, we learn all three in the U.S., which is different than in China. In China, they have a specialty and they'll just do one. But we learn all three usually in the U.S., but then most people will tend to specialize in one. But not always. And because Chinese medicine is less common in the U.S., we don't have as many people that we can refer to who do specialize specifically in certain things, which makes us need to be able to do it all as a practitioner. Even though, we'll tend to have ways that we will, each practitioner will tend to have ways that we lean, directions we lean toward, whether it's herbs or acupuncture or Tui Na.
So which one do you focus on?
I would say acupuncture. I certainly use herbs, but I don't feel like I think in herbs. I think in acupuncture, and which that's partly just me as a person, because I'm a very kinesthetic person, and so I learn through my body. I understand things through my body, and so like when I'm working with a patient and I'm gathering information from them, what's happening in their body is, so acupuncture, yes, but also I do a lot of hands-on, because I come from, my background is a body work background. So I do a lot of hands-on work too, that may or may not look exactly like Tui Na, because I incorporate, a number of things, but yeah, I'm more oriented toward that, toward acupuncture and toward Tui Na than herbs, but herbs are certainly, a big supporter of what I'm doing too.
Now, I hadn't heard of Tui
Na
Na before. So if somebody was looking for that, particularly wanting more hands-on, would it still be called acupuncture in someone's practice?
That's a good question. You know, I don't know exactly what, so, you know, the way that, so I went to a school, an acupuncture school, where we had a specific Tuina program where somebody could just do that part if they wanted to, but everybody who did the program learned Tuina and acupuncture, and then if you also were studying herbs, then you would study that part as well. I don't know that all schools offer Tuina, and so depending on kind of what part of the country you're in, or what, you know, what school your practitioner went to, or whatever, it may or may not be super available. But the way that I utilize it is, especially if I'm treating pain, I'm gonna use points and needle those points, or use moxa on those points, and you know, support the body in that way. But I'm also going to get hands on the tissues and you know, help things.
And that's
move.
like a manipulation.
Exactly, right. And so but you can get a treatment that's just Tuina, that it's like full body, and but I feel like in the U.S. it's not as common, and so here in Tucson you see that because the school here offers Tuina. So you know, you could call up an acupuncture office and say, hey, do you offer Tuina? And you know, and they would know what you're talking about.
So what would be the complementary, or the something that people would know? Like you mentioned chiropractic, or like cranial sacral. Like, are those equal to some of the things you're doing?
That I'm doing, like when I'm doing the Tuina.
Yeah.
You know, of course, it totally depends on what I'm treating. But a lot of it, oftentimes, okay, so when I'm treating pain, oftentimes it's an injury, and oftentimes it's a sports injury, and that's partly just because also of who is in my practice, because I'm an athlete, and so I see a lot of sports injuries and stuff. And so in cases like that, what it looks most like is, or what it's most similar to, would be like maybe like a deep tissue kind of massage, or even like Rolfing, or like, you know, because basically it depends on what tissue we're addressing, because a lot of the things that you mentioned like address specific tissues, whereas in Tuina, like, okay, if we're working on this elbow, we need to address the muscles, we need to address the fascia, we need to address the tendons, we need to address the ligaments in this, you know, in this joint. And so, you know, so a lot, that's why a lot of it looks like what I would say would be like a sports massage, or like a deep tissue massage, like that kind of thing. But it's not, and it can be full body, but you know, most commonly, like if somebody's coming in with an elbow injury, they're going to have needles, and then the needles will get pulled, and then we'll do some hands-on work that can be momentarily excruciating. I always tell people, you're going to hate me for a minute, but you're going to love me after this. and because there's like deep tension and adhesions and stuff that need to be broken up. So.
And I just thought that was important to point out, because the word you use isn't a word that people would be familiar with, and so just for them to have some sort of comparison, and therefore maybe not be afraid of it or trying it, because it's always getting the person in the first time, right?
Yes, right. Yeah, so I would say like, you know, like a deep tissue massage, sports massage, but also just massage is another thing that it looks a lot like, that it can look a lot like. And the difference, I would say, between Tuina and what people would consider a conventional massage is in my mind, at least, one big difference is Tuina is a lot more about pulling, whereas massage is more about pushing. And, you know, so it's about like creating space, like getting the muscles away from the bones and getting the circulation happening, versus, you know, using, and not that pressure isn't happening, but it's not all push, push, push. It's pushing and pulling, which is what Tuina means, grasp and pull.
Oh, that's really interesting.
Yeah.
Well, see, and I learned something new too. Okay. You've answered a lot of this, but one question I wanted to ask was, how does it help people heal? So is there anything else you want to add to what you've already said about acupuncture healing people?
Part of what I feel like my job is, as a practitioner, and it's a little bit bigger than the specific, like what's happening in the body, but I can address both of those things. But let me talk about what's happening in the body. So basically, so we have qi that's flowing along the channels. And so Chinese medicine used to be like you studied, you apprenticed with someone and you worked with them for years and years before you were, before, and then when your master died, then you became the practitioner, or whatever. But you would work with a master for years and years before you were practicing on your own. And it was an oral tradition. And so Chinese medicine has a lot of what in today's world we would call sound bites. Like it was, like these little things that are easy to remember, so that because there weren't textbooks, you were just learning from somebody who knew it. And so anyway, so there are a lot of really great little sound bites that go with Chinese medicine. And one that I really like is, let's see if I can remember how it translates. It's basically, if there is free flow, there is no pain. If there's pain, there is not free flow. And so what that means is that has a lot to do with how Chinese medicine treats pain. And so what that tells us is that if there's pain in the body, there is some obstruction to the natural normal flow of qi and blood. And so what we need to do is figure out what is causing that obstruction. And so, and what is being obstructed? Is it blood flow that's being obstructed? Is it qi that's being obstructed? And so we ask someone a bazillion questions to questions like, what's the quality of the pain? When does the pain happen? Where is the pain? Does it refer anywhere else? And things like that. And those all give us clues about also about what is causing the pain. So in other words, what the obstruction is, but also what underlying conditions there might be in the body that would give rise to this particular obstruction happening. And so we have to figure out specifically what the obstruction is. And the obstruction could be trauma. It could be that, somebody bumped into something and then there was bleeding, there's a bruise there, and so we would call that obstruction. So the term in Chinese medicine for obstruction is B, and so that would be a trauma B, and so we need to get that stuck blood out of there, and then the obstruction's gone, and then the qi and blood can flow normally, and then there's not pain. And so so blood can be an obstruction, and blood can get stuck for various reasons. But other things can be obstructions, and these other things that can be obstructions are things that, again, these are things that we don't quite have concepts for in Western medicine. So, for instance, cold can be an obstruction, heat can be an obstruction, phlegm and dampness can be obstructions, wind can be an obstruction. So, Chinese medicine sounds funny sometimes because, like, somebody might come in and after the assessment I might say, oh, well, you have wind in your channel, and they'll be like, that sounds weird. That sounds like I need to pass gas or something. And so there are specific points then that we can use, and that the function of that point is to release the wind. And so when the wind is no longer in the channel, then the qi can flow correctly, and then there's not pain. And so anyway, or like if cold is the obstruction, which happens, which can happen like if you're in a cold environment, or if you say you work at a grocery store and you're stocking the freezer, you're exposed to cold, and if you have a deficiency, like maybe you didn't sleep well, or maybe you had a fight with your kid, or whatever, and your own qi was deficient, then that cold can creep in and get into your own channels, cause an obstruction, and that causes pain. And it might be neck pain, it might be arm, shoulder pain, whatever. But, so we use different things like the tongue and the pulse and that sort of thing to figure out specifically what the obstruction is and where the obstruction is. So what channel it's along and what it is. Is it cold? Is it heat? Is it wind? Is it damp? Whatever. And so then we treat it appropriately, with points that are going to address that thing. Or like if it's cold, we'll apply heat. We use an herb called moxa to get rid of that, to like scatter that cold and bring heat into the channel to get rid of the obstruction. And so, so we have a much broader way of looking at pain and a more specific way of looking at pain, because Chinese medicine will look at pain as like, oh, there's something going on with the nerve. Like either that nerve is damaged or it's compressed or, whatever, something. And that just doesn't paint a broad enough picture to answer all the questions about pain. And which is why, Western medicine misses sometimes when they're trying to treat pain, and they hit it out of the park sometimes too when they're treating pain. And so anyway, so that's part of how it helps to heal, in that we can be very specific about what obstructions are happening. And this is just giving the example of pain, but which tends to be pain can be chronic and pain can be acute. And so a lot of the examples I was giving were more acute pain, like an injury or something that kind of just started. But certainly there can be chronic pain. But then there's also all of the underlying things, or the pre-existing things, whether it's something that's sort of constitutional for someone, or something that kind of developed over the years. Like the most common thing we see is someone having years and years and years of stress, and then that impacting their body. And that will show up differently for different people. But for, one of the more sound bites from Chinese medicine, we consider women to be creatures of blood, and men are creatures of qi. And so what that means is that, like in a situation of chronic stress, eventually for a man that will tend to impact his qi, and then we'll see qi deficiencies or qi stagnation, and things like that. Whereas women, it will tend to impact their blood, and so we'll see blood issues that might show up as menstrual issues, or it might just show up as fatigue or a different thing, or the body not being nourished to the extent that it should be because the blood is deficient in some way. And so so these other things that are also the case, that are kind of coexisting with whatever an acute situation might be, also need to be addressed for that acute situation to really completely be addressed. And so so we have a concept in Chinese medicine of the root and the branch. And so the root is like root underlying causes of a problem, and the branch is how it's manifesting. And we want to address both of those things, because if a person comes in and you only address the root, and you don't even touch their neck, which is what they were complaining about, then they're like, nothing happened, and it does. You can't fix neck pain only by addressing the root. But also if you only address the branch, then the root is still there, and it will keep happening over and over. So we need to address both of those things. So Chinese medicine is very holistic, and that is very much how it helps people heal, because. So this goes back to the other thing that I was going to say. That part of my job as a practitioner is to see this big picture, and part of the big picture is, how is a person presenting right now? What is their pain? What's their dysfunction? What's their, what isn't working well in their life that's bringing them in? So there's that, but then there's also, how did they get to that place? And so what's the underlying stuff, and what's the story that got them through their last 20 years to this moment, and because knowing that informs how we get out of that situation and into a future that is healthy and full and complete. Because we need to know what that background story is, so that we can kind of unravel that whole thing and put them on a different trajectory that is going to lead them into a future that doesn't include whatever that present manifestation is. So seeing that big picture that exists in their body and in their emotions and in their day-to-day life, but also exists throughout time. It's their history, but also sending them into a healthier future. It's that four-dimensional view, which is quite holistic, that really helps people heal, because then they can have this image moving forward of what a healthy life looks like, rather than because I'm clear that most people expect their life to be some sort of process of slowly degrading and having more and more pain and dysfunction the older they get, which is not really how things have to be. And so if we understand health and what we need to do in general, but for each of us as an individual, what we need to support ourselves, then we can kind of have this different vision and image of ourselves in the future, and what health looks like, at an older age or whatever.
I love that. That I feel like is kind of my mantra. My goal of teaching people is that you don't have to fall apart. You don't have to
Right.
age in a painful way.
Right.
So I really like that
Yeah.
you said that. 'Cause
Yeah, totally. Yeah. I mean, it's just, and we see it all around us, so we think it's normal and natural, but it's not. It's not the way it's supposed to be. And we, you can see, I mean, you can't see, there aren't a lot of like hunter-gatherer, kind of cultures around in the world anymore, but if you can find them, if you can observe them, you see vibrantly healthy people in their 80s and 90s, and that are still doing the things that the 30, 20 and 30-year-olds are doing, that because their body's not full of toxins, because toxins are obstructions to the flow of qi and blood, and so they don't have toxins, they don't have concepts of that they should be breaking down, and all of these things contribute to to remaining vibrantly healthy, right up to their last day of life.
Well, I have kind of a tangent question.
Yeah.
With talking about people aging and, so they come in and they're in pain. Have you seen and do you believe that someone can be changed even at a later stage? Because I talk to a lot of people who are like, well, it's too late for me, or I've already have these bad habits, or I've already damaged something inside of me.
Right.
What do you think about that?
Absolutely, people can change at a later stage. But the trickiest thing is not so much changing, well, I mean, it is changing their body to a certain extent, but the most important piece of that picture is their underlying beliefs, their expectations, which also can be changed. And that's partly why in my practice I also have like hypnotherapy that's available and things like that, because things that access the subconscious, because we have to get into that subconscious level and change those beliefs there, because every single cell of our body is listening to, it is in the environment that we're creating. The environment we're creating is our beliefs. And so if we can change those, then the sky's the limit. And, but part of the issue is even identifying what those are, and having a thought about what could be different and whatever, especially when we walk around in our culture and we don't see a lot of evidence for, for vibrant health later in life, And so it's hard to wrap your head around being different from everybody else that you see. But if the beliefs are in place, then, or we're able to shift those, then absolutely we can make changes later in life. No doubt about it.
Interesting. Oh, I wish we could even talk more about beliefs, but we want to focus more on acupuncture. But that is so, I believe that so much.
Yeah.
And that's a conversation that we have a lot with people, is about looking at our belief system.
Yes.
All right, so I do have a few more questions just to kind of educate our listeners. Does acupuncture hurt?
That's also a great question. Of course, the best answer is no. and that is an accurate answer. However, when we're treating pain, we're moving an obstruction. So it's the obstruction that is the pain. And when a needle goes into a point where the chi isn't flowing, you feel it, but that also tells us that something's happening there. So does it hurt to lay there on the table with needles in? No. Do you feel the needles going in? Sometimes. I would say 90% of the time, or 90% of the needles that I put in, maybe 95% of the needles I put in, people don't even feel at all. And then 5% people feel it, and usually with those you feel it, and then moments later you don't feel it anymore. And also, if you do keep feeling it, then we can adjust it so that you don't feel it.
Because it's not the needle itself that's hurting.
Right.
I like how you explain it. It's actually I imagine it like an energy ball or something that it's going into, and so it's tender.
Yes.
And so it kind of hurts in that moment.
It might, but most people's experience is that it's totally pain-free. But then there's also the situation where it's it feels fine all the time, and then one day somebody comes in and they feel every single point that comes in, or that you put in. And in situations like that, we can usually find a reason for it. It's usually either that they're dehydrated, because the chi does conduct through fluids of the body. So if the fluids are deficient, it's harder for the chi to conduct. And so you feel every single needle when you're dehydrated. And same thing if you are low on sleep. Like if you hadn't really slept the night before and then you come in, same thing. You feel every single thing. And that's more of because your chi is deficient from not having
So if people are in that situation, dehydrated or didn't sleep enough, would you still want to treat them? Can it help them?
Yeah.
Okay.
Yeah.
Okay.
I still would want to treat them, and,
Okay.
and I would send them home and tell them to hydrate, and they'll get rest right then and there on the table, and they'll definitely feel better leaving than they did when they arrived. So yeah, so it's not like there's never any discomfort in a treatment, but that's anything. There's a massage or anything, there might be some discomfort in the treatment. But typically is pretty pain-free.
Okay. And the main reason why I asked that question is because I think sometimes if people haven't experienced or even seen what an acupuncture needle looks like, they're picturing needle. And none of us like a needle going in our arm like to draw blood.
Right.
So maybe you can just speak. I know we don't have a visual, but just kind of explain a little
absolutely,
bit.
yeah, because most people's experience is like, yes, getting blood drawn or getting a shot. And so in comparison, those are needles. The needles they use for that are hollow because something is getting pulled out or put in. So if we took a needle like that, we could fit 20 acupuncture needles inside the opening of a needle that would be used to like draw blood or something. To give you an idea of how much smaller the needles are, the needles are basically they're closer to the size of a hair. You have hair coming out your body everywhere, and it doesn't hurt. And so so the needles are very fine. But you're right. People have this concept that they're going to be, that like a sewing needle is going to be put into their skin, and it's nothing like that. It's a very fine needle, and and of course I see people all the time who are like, they wanted to try it, but they were really nervous because they're afraid of needles, and and I have this one patient who, once she got needles in, she's like, oh, this feels fine. There's no pain. It's great. I'm glad I'm here. I feel really good. And typically people then, once needles are in, they get really, really relaxed. And and they leave going like, whoa, I never would have thought that laying here on a table with needles in me would be so relaxing, but it's incredibly relaxing. But this one particular patient, she's like, I'm not going to call them needles. I'm going to call them filaments. Just so she can have a different word for it, so it's not needles, so it doesn't have to be attached. Yeah, me too.
Yeah, because mentally it gives you a different picture of not having this big needle like you described in you, but more of like a little prick or a little, I mean,
Yes, totally.
I love that. Yeah. That's a good example. All right. Sorry about that. Come on. All right. Well, the other questions that I thought would be good to talk about is, how does an appointment work? And I know you're speaking just from your practice, but I'm sure it's pretty general for anybody else, so people could kind of visualize what does it look like.
Yeah, that's a great question. So we have very specific, a very specific format that we tend to follow in Chinese medicine, and the longer someone has been in practice, the more that format happens more quickly and is more condensed. But especially new practitioners are like following this really specific thing where we have what's called the 10 questions. And so we're asking these 10 questions that are going to cover everything and paint this whole picture for us. And the 10 questions involve things like around pain and sleep and digestion and sweating and energy and menses and like all of this stuff that gives us a sense of because what we're looking for as a practitioner is we want to know what's happening with their qi, with their blood, with their yin, with their yang, which blood is the only thing that Western medicine is also looking at, So we have these 4 things that we're looking at, but we're gathering that information in a variety of ways. So we ask the 10 questions, but the 10 questions is just part of what we call the 4 observances. And so those are where we're using looking. So we're looking at somebody's complexion, we're looking at somebody's tongue, we're looking at how they move and how they hold themselves. And then, so there's looking, there's smelling, so what somebody smells like, which is like kind of horrifying, I think, for patients to think that we're smelling them, but we are. And, but that tells us about what imbalances might be going on. And then there's asking, and that's the 10 questions, and the 10 questions that are often just springboards for other questions. But we're gathering a lot of information about what the person's experience is, on various levels about their pain or about their life or whatever, and then touching. And so we're taking the pulse, and taking the pulse in Chinese medicine is very different than going to the doctor and having your pulse taken, because we're checking out the pulse in 3 positions on each side, and on different levels. So superficial pulse, a pulse in the middle, and a deep. So there's a lot of information we're gathering from taking pulses and from looking at the tongue. So most of and not every practitioner does that. Some practitioners will just treat you based on how you're presenting. So your signs and symptoms and what you're asking to have treated. But most practitioners will also look at your tongue and take your pulses and use that to put together the big picture. Because if you're just treating based on symptoms, you don't always know exactly what the obstruction is or what the underlying situation is. And so for me, it's important that I'm putting together that big picture. So I want to look at the tongue, I want to check the pulses, and I want to verify if I'm coming. So then what I'm doing as a practitioner is I'm coming up with a diagnosis, and that diagnosis is a Chinese medicine diagnosis, and it may be completely different than anything in Western medicine, or it might be really similar to something in Western medicine. But then I come up with a treatment plan based on that diagnosis. So if I'm going to make a diagnosis, I want to have evidence that backs up that diagnosis in at least 3 ways, which is partly why I want to look at the tongue, I want to check the pulses, and I want to ask them a lot of questions, so that I'm really clear about what I'm treating. So basically, for a patient coming in the first time, we might talk 20, 30 minutes, depending on what they have going on, for me to gather all this information. And sometimes they're presenting in a really clear, in a way that's like, where it's just like quick and easy for me to see what's going on, and we can have them on the table in 10 minutes. But sometimes it's a much more complex case, and there's a lot more information that we need to gather. So it might be, it might take 30 minutes or so to kind of put all this together. And then once I have the diagnosis, and a treatment plan, then somebody's going to be on the table, and we'll put needles in a number of the points, and then they will get to chill out for 20 to 40 minutes, depending on what's going on, or at least 30 to 40 minutes. And then what I will do then, especially if they're coming in presenting with pain, is after needles have been in for 20 minutes, I might remove some of the needles so I can do some hands-on work in the area of pain. And for my own self, I do like to incorporate craniosacral too, which is kind of in that camp of Tui Na, but it's more subtle kind of stuff. But it just helps to make sure that that everything is flowing, and even the more subtle stuff is flowing really well in the body. So a treatment will tend to take about an hour. It might be an hour and 15 or more, and it can take much longer if there's a lot more hands-on work that needs to happen. And then at the end, then we take out the needles, and they feel so much better than when they came in. They can't even believe it, and they're ready to make their next appointment, and we go from there.
Yeah, so talk about that, the next appointment. I know none of these next questions I'm going to ask are going to be the same for each person, but in general, do people come once a week? Do they come once a month?
Right. So it really depends on what we're treating. If somebody is pretty healthy, but they're coming in with an acute injury, we're going to treat it, maybe 3 times, bam, 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 right in a row, and then they're done. And that right in a row might be, maybe 3-4 days in between. And but also they're going to be doing herbs in between also on their own, so they're really getting treated daily, as they're using the herbs. So it might be, and if we're treating something that shifts really easily, like wind, it's a one and done sometimes. They just come in, we remove the wind from the channel, and they can turn their neck again, and they're happy, and they can go on their way. Which is, but most people have other stuff going on, and so, we're working on other stuff. So chronic things take a lot longer to treat because they took a lot longer to manifest. And so because we're not just treating this immediate manifestation of this chronic thing. We're treating the past several years also, so it takes much longer to get that to shift. And it also depends on a person's vitality. But I like to start out, if we're treating something that's going to take a little longer, I like to start out with once a week treatments, and how, like, if somebody's vitality is lower, we're going to do them a little bit closer together, like maybe every 4 or 5 days, and do that for a few weeks. Because what I want to see is, I want to see a treatment making some change in the body, and I want to see them again before things slide back to what they had been when they first came in, so that we are building the treatments on each other instead of going back. And we won't be going back to square one, but we won't be making progress as quickly if we're not building on things. So, so a treatment once a week for most people is spacing the treatments in a way where they get a treatment, things happen, they kind of integrate those things, and then we do another one, and we're still building on that previous treatment. And so, but most people will graduate from the once a week thing within a few weeks, and then we're like every 10 days or every 2 weeks, and then we're like every 3 weeks or every month, and then eventually people are on more of a maintenance thing, where maybe it's once a month or once every 6 weeks, or 4 times a year, or whatever, or basically, or as needed if something else comes up. So yeah, so it totally depends on what we're treating, and the person and their vitality, and what they're doing outside of treatments and in between treatments. So their lifestyle stuff. Like people will come in and ask me, can acupuncture help with weight loss? Well, yes, but not as much as what you're doing in between treatments. And because that it has a stronger impact and a more constant impact on your body, and also not as much as sleep, or like you can't integrate the changes that we're asking the body to make if you're not sleeping, because that's where really key integration happens. And so so there's all those other factors, but certainly it's not the kind of thing where a lot of people are afraid of, like, if they get started, that they're going to be expected to come once a week forever. It's definitely not that. Like, personally, I want to get somebody well and back to their life so they can send me their friends and family. I don't want to keep seeing them every week forever. I want to keep getting people well and getting them out of my practice and just seeing them when I need them, and or when they need me, but not constantly.
But you can tell by working with someone when they're to that point where you might say, I know we always hate the word like perfect or complete or balanced, but close to that, to where you feel like you're good. You can go out.
Yeah, kind of the rule of thumb from the patient's perspective is, when they're looking forward to their acupuncture treatment, then yes, they still need to be coming. When they get to the point where they're like, oh, I'd rather go throw a baseball with my son, then they don't need it. They're at that point where they'd rather be using their energy for something else, and they've really resolved a lot of what we're doing. So they can kind of, like, we have this idea in Chinese medicine that whatever we think about, like, we're sending our chi in that direction. And so when you're thinking about, like, you can't wait for your next acupuncture treatment because you're going to feel so good from it, and that kind of thing, like, that's an indicator that that's important, and that's what you need to be doing. But when you're like, oh, I'd like to be working out, or I have this work I want to get done, or I'd like to start this project, then that means that you have the chi to be doing those other things instead, and that's what you should be doing.
Oh, I like that. That's a really good explanation of that. All right, well, the last question is, I just thought it would be really great for you to tell us the kinds of things, you've already mentioned some of them in some of your answers, about the kinds of things that you treat, that you see, so that people can see the big picture of the types of things that they can come in for. Because otherwise, I think they're just thinking only pain. Right.
It's huge. Allergies, digestive stuff, and the thing is, this is fun as a practitioner of Chinese medicine. People will come in and they're like, oh, I'm such a mess. I have this going on, I have that going on, and blah, blah. And I'm going, oh, that's all the same thing. It's just one thing. And so, but it's different manifestations of the same thing. And so we can treat it all really easily, and it's just, one treatment approach. But so like somebody might have allergies going on. which is also related, like seasonal allergies, but that might also be related to skin stuff that they have, which could be another manifestation of it, which also could be related to digestive stuff, which is kind of might be more of the root of why they're having allergies, happening. So those sorts of things. Headaches are pain, but the headaches are a big thing that we, see a lot of and treat. And that can be jaw pain, it can be eye pain, it can be, tension headaches, it can be migraines, any kind of pain. Of course, Chinese medicine is well known for treating fertility, both male and female infertility. And so we see a fair amount of that. And supporting, and not just fertility, but then also supporting somebody through pregnancy. I see a number of patients to stimulate labor and get that going, and then postpartum, support, because after having a baby, there, that's a lot for a body, and there's a lot of support that we need to do to help the mother kind of get things back together, which then helps the baby, and and there we are treating the whole family, but so all of that kind of stuff. There are a lot of things that are a little trickier, more chronic things like that, like we can't make it go away in a few treatments. Things like Parkinson's or Alzheimer's or and other dementia and things like that. Like these are chronic things, like I said, that like these are things that have been in the works for decades, and so we're not going to turn them around quickly, but we absolutely can slow the progression. And some things we can turn around, but it takes, it's like, turning around the Titanic. It takes a while. You got to slow the boat down first before you can make a turn. And
I have a funny example though.
Yeah.
I know a friend that came in and she was coming in for headaches, but it helped her back pain.
Right.
Do you find that happens?
Oh, absolutely. And that's the thing too, like if her headaches are basically an obstruction in the channel that we call is the urinary bladder channel, which sounds funny because it runs from the corners of the eyes up over the head. It's really not that close to the bladder and anywhere it goes, but it goes down the back, and so it's the same pain. It's the same. It's obstruction in the same channel, and so and likely with the same underlying cause. And so so things are related to that, but internal things like gallstones and kidney stones and whatever, liver issues and internal organ stuff, we absolutely treat that, and a lot of it's different too, or like thyroid stuff and whatever, and we don't translate it directly, so we'll, like if somebody's having thyroid issues, I still treat them using Chinese medicine diagnosis. So I'm looking at, what's happening with their spleen qi, what's happening with their kidney yang, how does that need to be supported? And so supporting those things essentially supports thyroid function. And we work together, like I can treat that, but if they have deficiencies in that are keeping them, or excesses or whatever, that are keeping them from being able to make enough thyroid hormone, then I'm not going to actually be as effective as I will be once they get on some hormone replacement, some thyroid hormone. Then their body has so much more support to be able to respond to what I'm doing. So we do a lot of integration with Western medicine, and sometimes, and hopefully it's maybe getting on an antidepressant or getting on some medication, and then we can do a lot of work on the physical, on the emotional, whatever, and ideally get them off of medications also. A lot of people come in with a goal of wanting to get off medications, and that's totally something we can support, but we do that, we have to do that in conjunction with their physician, so that the prescribing physician is overseeing that process of getting off things. But so for instance, we can treat blood pressure really well, and all kinds of stuff that I think that people wouldn't necessarily think of with Chinese medicine. But if you consider that 3,000 years ago, Chinese medicine was the only show in town, and no matter what was going on with you, whether it was an infection or a broken bone or or a breech presentation of a baby or whatever, Chinese medicine is what there was to treat it. So we can treat anything that happens with the body. Our restrictions really come from like other fields having like legal authority to be the only one that treats certain things. So like we're not allowed to treat cancer, to be like a primary the main provider for a cancer treatment. Somebody has to be overseen by an oncologist, but we can treat. And it's not that Chinese medicine can't treat it, but we're not allowed to treat it. And like broken bones, or even bone setting, where chiropractors do that, we're not allowed to do it in this country. But it is part of Chinese medicine, and it's part of Tuina is bone setting. I've seen a number of patients who are going through chemotherapy, so I'm not treating their cancer, I'm treating the effects of chemotherapy to make that more tolerable for them, and it helps so much. And it helps with the nausea, it helps with the energy, it helps them with the general malaise that comes from it and all of that. And so there's so much that we can treat and do treat, and like I said in the beginning, once people start receiving it, their body understands what it can do, and they just know what they can, they're like, oh, I'm sure that this is going to help this and this also. And so so it's like the sky's the limit, really.
It's that contagious.
Right, exactly.
Well, I really appreciate you telling us more about acupuncture. I haven't personally had a lot of treatments, but I've had enough that I know I really enjoy it. But I like understanding what it's doing and how it's working, and thought that might help other people be open to looking at that as a treatment.
Yeah.
So the last thing is just telling us how people can find you, whether it's following you or coming to visit you. And I realize you're only in one location, but then maybe you can also tell us about how maybe they can find someone in their local area, if that's a connection.
Yeah, sure.
Yeah.
So as far as finding providers throughout the country, the NCCAOM website is a great place to go, which is, I believe it's just nccaom.com, and they have like a find a practitioner thing. And so NCCAOM they're the body that oversees the national certification. It's their boards that we have to pass to be able to get a license and practice. And so they list providers, and that's a great resource to use to find providers in the area. And I also like, networking and that kind of thing. If you have a chiropractor or a naturopath or a midwife or whatever, most likely they know an acupuncturist, Finding me specifically, my website is livelifeintheflow.org, which is a great place to go, and that directs you to what we're doing here and to scheduling, and you can just schedule online, and all of the social media stuff is in process, but not all grown up and mature yet. But that can, you can get to that through so the website's probably the best place to go, livelifeintheflow.org. Let's see what else.
Are you doing educational stuff on your website?
That's not there so much yet.
Okay.
I have a lot of background in education. I taught at the acupuncture school for a number of years, and so at this point in my practice, so I'm in the process of going from being a single practitioner to running a practice that has multiple practitioners with various disciplines, and so we're just getting off the ground with all of that, and so a number of those things are not yet in place, but as they are, they'll be available through the website.
Thank you.
Yeah.
I appreciate it.
Yeah.